Good afternoon and welcome to this afternoon's Plus You Conversation. I'm David Michael, Executive Director and CEO of Habitat for Humanity, the Tri-State, located in Huntington, West Virginia. I'm pleased to welcome today a very esteemed panel to the conversation. In the interest of time, I'm going to keep introductions short, but I do want to encourage our audience to seek out some more information about our panelists and their organizations they represent when you have an opportunity to do so. Today, I'm happy to introduce three individuals who will be participating on today's panel. Dr. Anthony Carino, who leads the Project for Psychiatric Outreach to the Homeless, a New York nonprofit that provides services for homeless individuals at shelters, soup kitchens, and outreach programs citywide. Welcome, Dr. Carino.
Thank you.
Next, we have Dr. Jonah Deschamps. He is a senior research scientist at the Trevor Project, a nonprofit providing mental health support and suicide prevention services among lesbian, gay, bisexual, transgender, queer, and questioning youth. Welcome, Dr. Deschamps. And last and certainly not least to our panel is Shannon Razadin. She is the president and CEO, president and executive director of the Military Family Advisory Network, an organization that connects military families to resources, people, and information that they depend on to successfully navigate all phases of military life. Welcome, Shannon.
Thank you so much for having me.
Our fourth panelist, who is Lyndon Flowers, who is a co-founder and executive director at the Dinner Party Labs, an organization building a community of 21 to 45-year-olds who have experienced the loss of a parent, partner, child, or close friend to cultivate healing and relationships that matter. Unfortunately, was unable to join us today, had a last-minute emergency. So we will progress with our panelists here in just a moment. I do have a little bit of introduction beyond that for our session. Here at Habitat for Humanity, we're convening this panel today to mark Mental Health Awareness Month, which is obviously the month of May. We know the fundamental value of home, but we also know that a safe, secure home is linked to many other areas of our lives, including overall mental health awareness, and can be also a springboard for lots of things that lead to success. In fact, last week, the U.S. Surgeon General released an advisory calling attention to the epidemic of loneliness and isolation and a lack of connection across the country. At Habitat for Humanity in the Tri-State, we have had the occasion to partner with the U.S. Department of Veterans Affairs and U.S. Department of Housing and Urban Development on a pilot program that will bridge the housing continuum with a pathway for veterans exiting homelessness to attain affordable homeownership opportunities. This pilot program, has been a direct result of a couple of unfortunate incidents we've had with veterans who were in our initial Veterans Housing Initiative program and lost their case management services as part of the transition from the HUD-VASH program as we knew it prior to our pilot project, to moving into their Habitat house when those case management services ceased. My staff and I don't have, we are not those folks. And so when those services were lost, we had the unfortunate incident that two of our veteran participants, veteran home buyers, committed suicide. And so in an effort to prevent that or try to eliminate that from happening in the future with our current participants and future participants, I reached out to the VA medical centers. It was in Denver, Colorado, with their suicide prevention team. And they provided me resources not only for my staff, but also for the families that we were working with to help us get through that time. And then that kind of evolved into a whole different level of conversation with the Department of Veterans Affairs and rolling out our partner project or a pilot project where we now have HUD-VASH users who are able to continue with their case management piece, which is critical to their success of being a homeowner, as well as that HUD-VASH can pay for some or part or all of their mortgage payment to Habitat. So that's kind of how we evolved to that. And it's been an interesting transition working through, as you can imagine, different levels of the Department of Veterans Affairs and Department of Housing and Urban Development to get to where we're at today, and hopefully being able to scale this project out to several other folks. Um, and then I've seen how one intervention creates hope within families and communities, but it also puts them on a better path. Often, minority and underserved communities do not receive the types of services that can make all of the difference. And I think service to veterans acts sort of as a tip of the spear or a focal point and can act as a model that can be expanded to serve other populations. So, with that, I would like to get to our panel discussion. For now, you've heard enough from me, and I would like to turn it over to our experts in the field. And I'm sure you all will enjoy and hopefully glean some information to better serve your communities that you're working in as well. So I'd like to start with Shannon. Um, Housing is a key component of the resources you provide for military families. How do the unique challenges faced by military families intersect with issues of housing and mental health for veterans and local communities during and after service?
Yeah, thank you so much. It's a really great question. And in addition to Mental Health Awareness Month, it's also Military Appreciation Month. And so I love this intersection point in talking about serving the military and veteran community. So, as an organization, we really focus on understanding the lived experiences of those we serve. And we do that through convening an advisory board as well as conducting scientific research. And based on what our research tells us, it really informs us as far as where we lean in as an organization. And from there, we work to inform and catalyze solutions that are meaningful and measurable in people's lives. And so we've been looking at housing over the course of the last several years, really starting in 2019 when we heard from our advisory board about issues with privatized military housing. From there, we fielded a survey and 17,000 military families responded. And we really were at, the tip of the spear as far as what needed to be done to rectify challenges with military housing. And that looked like a tenant bill of rights, a universal lease, so on and so forth. The reality is, though, that we know that most military families are living outside military properties or living out in the community. And that's about 70% of military families who are not living in privatized military housing, but are living in everyone's neighborhoods. And some things that people may not be aware of is the transience related to military life. So, military families move on average every 2.5 years. And with that comes this full restart of your life. Everything from finding a home to finding schools to getting settled, a new job, new doctors, new dentists, all the things have to restart on average every 2.5 years. And for some communities within the military, that's even more frequent. So, as an organization, we've been focused on really understanding what are the challenges, but also what are the intersection points. And one of the things that we have seen is a housing cost burden that many military and veteran families are experiencing. And what that means is that people are paying more than they can comfortably afford for their housing. And when it hits about 30%, people are housing cost burden. We see that nearly half of our actively serving respondents are experiencing a housing cost burden, and it goes up to around 60% when we look at the full population. And so then when we peeled that back a little bit further, we looked at things like what are the implications for mental health and overall well-being. We see statistically significant correlation between people who are experiencing.
I think we may have lost Shannon there. Hopefully, we can get a new connection back with her. Um, because I do have another follow-up question to ask her about. So we'll move on down for our next
Oh, I'm sorry.
panelist for Dr. Carino. Can you talk about the intersection of mental health and housing insecurity disproportionately affecting Black, Indigenous, people of color, veterans, and/or other underserved populations?
Yes, thanks, David. So we do know that homelessness
Oh,
in general is a
I
crisis
think you're
that's
on mute.
driven by
Oh,
a lack of affordable and accessible housing.
no.
Um, and what we do know is that the individuals that experiencing homelessness are oftentimes underserved populations. Specifically, we see BIPOC individuals are at increased risk of homelessness, largely due to structural and racial inequities in housing policy and other structures. We also see that individuals that are the veterans, people with mental health conditions, and people with substance abuse and addictions issues are at increased risk of homelessness. So these vulnerable populations are more likely to be the individuals experiencing homelessness. In terms of the intersectionality, and in particular for our veterans, um, there is an increased risk of mental health conditions with homelessness, and we see an increased risk of suicide by about 4 to 5 times matched sort of controls associated with homelessness. So we see a vulnerability there. Um, we also see that individuals with trauma history, and in particular, adverse childhood experiences like physical trauma or abuse, are more likely to experience homelessness. And we know that many of our veterans have trauma history as well. So there's also other pathways to homelessness, including intimate partner violence and other inequities that occur. And so what we do know is that given this intersectionality, underserved populations are more likely to experience homelessness and experience an increased risk of mental health consequences, whether that's suicide, overdose, and negative physical health consequences. And our veterans are vulnerable population for that. Um, one piece that we see quite often is that um, even though these vulnerabilities exist, that there can be a real response to treatment, care, and specific interventions that many of our veterans and other vulnerable populations really respond to. Um, and these interventions can really lead to improvements in healthcare outcomes and housing outcomes as well.
Thank you. Um, so next on the panel, we have Dr. Jonah Deschamps, who works with youth and other groups. So when um, you in your work with the LGBTQ youth community, um, youth are primarily vulnerable, a particularly vulnerable group across the country. What are some of the unique challenges that that particular population faces when seeking mental health support?
Thanks so much for asking this. It's an important question. Yes, you are very correct to note that LGBTQ young people are vulnerable both to poor mental health and higher suicide risk and to housing instability. We also know that LGBTQ young people are overrepresented among young people experiencing homelessness. And it's really important when we look at both of those sources of disproportional risk, or excuse me, statistics about disproportional risk, to understand that we're looking at the product of a structural problem and the product of structural forces and anti-LGBTQ bias in terms of families sometimes who then sometimes will kick their child out of the home, causing some of that risk to unstable housing. Or some of these more mental health risks are the product of the stress of being an LGBTQ person in an anti-LGBTQ society. So that's the framework that we like to use to explain all of our work. I really appreciate you asking about the unique challenges in accessing care because we actually can provide pretty detailed information about that because we ask young people very directly about those kinds of barriers. So I'm going to take a look actually at our most recent, we just recently released our 2023 national survey on the mental health of LGBTQ young people. Um, and so the top three reasons that young people tell us they have a hard time at getting mental health care if they want it are that they're afraid to talk about their mental health concerns with someone else. They don't want to have to get their parent or caregiver's permission, and they're afraid that they won't be taken seriously. So I think that really speaks to a lot of the stigma around mental health care more broadly. I think that stigma is particularly acute for LGBTQ people and adults too who are seeking mental health services and who have to consider whether or not the mental health provider is going to be able to talk about their LGBTQ identity with affirmation and cultural competence. We also see some other structural barriers on this list. 38% of young people told us that they can't afford mental health services. Um, They say that their parents or caregivers won't give permission. So there are a number of factors, both in the home and sort of more structurally, that are impacting folks' access. I think the other key dynamic that I want to really note and name that doesn't necessarily show up in our data, but is important, is this year in particular, in 2023, we have seen a humongous onslaught of anti-LGBTQ bills, which primarily have targeted LGBTQ young people, and particularly trans and non-binary young people. And when we see states like Texas and Florida uh, criminalize the provision of gender affirming healthcare, then that can cause a culture of fear. And so I think there's also that may be contributing to a lot of this fear that LGBTQ young people feel. They may worry that if they talk to their therapist or even their school counselor about the things that they're experiencing with their mental health, they could potentially be opening themselves up to discrimination, harassment, and maybe even, in the case of Texas, being removed from their family. And so that is also a really, really important factor to think about when we try to address how can we help LGBTQ people access mental health services.
Thank you very much. I want to circle back to my second question I have for Shannon. Based on your experiences, what are some effective strategies for addressing the mental health needs of military families, including veterans and local military communities?
I think that we really just hit on some of it. And, the military community and veteran community, there are some nuances, but a lot of what, you mentioned around the LGBTQ plus youth, like there are some real similarities here that you might not think out of the gate. So there's the stigma, there's a culture of pride, there is concern that if you are seeking out mental health support, what could that mean? In the military community, could that impact your security clearance? Does that bring unwanted attention to you? And so we as an organization have really been focused on creating the connective tissue so that when someone comes to us, maybe it's for food related support or housing related support, that we can also ask them how they're doing in other areas because we know from the data that these areas of life are connected, right? So if people are coming to us for support around their housing, we can ask them how they're doing. Have you made connections in your local community? Have you checked out this resource that the military provides? Or do you know about this community based organization that's there locally? Because the reality is that when you're transient and when you're moving all the time, it can be really hard to get settled and situated in a new place and figure out the who's who. And, you're not necessarily near a network of support. You don't have necessarily family living nearby. Military spouse unemployment is a huge problem. And so there can be that loss of identity that many people experience. And so we're really, really focused on making sure that we're never just addressing one issue, but we're asking about and providing that listening ear so that we can help make sure that people are connected to other areas of support, even if they don't necessarily bring that up. The other thing that I think is really important is storytelling. That allows you to celebrate the help seeking behavior and encourage other people to get the support that they might need. And so we work with our advisory board, we work with our network to really elevate these stories of success or in the challenges that people face, because then people realize that they're not alone. So whoever's on the reading end of that, it helps them see, okay, this person went through this too. They're getting through it. I can too. And really, we see the storytelling be a very powerful component to promoting that help seeking behavior that's so important.
So, um, Shannon, and then the other panelists can jump in on this one as well because we all work in our own communities. But can you talk about how community based organizations um, and the role that they play, um, how they can partner together with maybe you all or with other organizations in serving the populations that we serve, and what maybe some successful approaches have been in that kind of role of community based organizations?
Yeah, a lot of it comes down to cultural competency. And so making sure that you understand the experiences and challenges of those that you are serving. And so we as an organization are really focused on elevating those lived experiences so that everyone who's serving the military community is aware of the challenges, is aware of the things that people are going through so that they can be aware and really support families in the ways that they need support. And so knowing that people are struggling in certain ways and knowing the resources is a really huge step. And we're really focused on leveraging data in our advisory board to make sure that we're doing that, but making sure that we're using the proper language, making sure that we are recognizing the environmental things that surround a certain issue or challenge that families might be going through is really important.
Thank you. I agree. I know when just because we rolled out a specific housing initiative for working with veterans who were formerly homeless in our community, that brought in a whole different level of conversation for us. And even working with the case management staff at our local VA medical center, um, it was a whole different language than what we were used to on the habitat side of the equation. And it gets back to that cultural competency piece and understanding where folks are coming from, where they've been, where they're coming from. Um, Sort of a same question about the community-based organizations. Um, and this one may be for Dr. DeChance to take a stab at, or if Dr. Carino would like to talk on this one as well. How can mental health and housing services be made more inclusive and affirming for the LGBTQ plus communities?
Great question. Um, I really echo Shannon's comments about cultural competency. So making sure that practitioners in your practice or in your local community health service, have a sort of basic understanding of LGBTQ identities and issues. And then moving beyond some of that basic sort of glossary definitions, what does it look like to be an LGBTQ person in your local community? And in that sense, I think a combination of national organizations and local community partnerships can be really beneficial for local groups, right? Because I, as Trevor or other large national organizations like PFLAG or other LGBTQ organizations can come in and we can give you a lot of statistics and data. But we know that in local communities, these issues actually look very differently. And so making sure to connect with folks in your local community to understand, what are the unique challenges that LGBTQ people are experiencing, because it comes down to something that Dr. Carino mentioned as well around LGBTQ people also have other identities, right? We also have a racial or ethnic identity, we have religious and cultural identities. And so, really trying to seek out folks who are living at the intersections of those identities to provide their lived expertise, to really try and understand, okay, how can we provide mental health services in this context and to this group?
Fantastic. Dr. Carino,
I
do
think
you go ahead?
yeah, I think thanks for that. And I think another approach that an additional approach that can be helpful is by um, is to ensure that the psychiatric services, the primary care services, the addiction services are accessible to LGBTQ individuals and welcoming. And there's different approaches. I think Dr. Chance outlined many approaches. I think that can be effective. Another component is to actually embed the services in the community so that there are less barriers for vulnerable populations and underserved populations to access them. Because one of the things that we see is that individuals with intersectionality um, have barriers to effective care. And by sort of bringing those services, making sure that they're welcoming and affirming and also accessible in the community, that can be a powerful model. So, one example is to actually bring psychiatric care and mental health professionals to permanent supportive housing sites, to sites where people experiencing homelessness that are vulnerable and underserved can access them without the sort of traditional barriers that a traditional healthcare system or traditional clinics may face. The other approach is to very much have an approach of person centered, trauma informed care, in which so many of the individuals that we serve experience trauma, the trauma of homelessness, but also other trauma from these policies, from the environment, from interpersonal trauma. And by providing services that are informed, and trauma informed and accessible, um, folks can access them and oftentimes do respond to treatment.
I'd love to piggyback on that if I can. I think it's also important to realize that you might be the only human that people might actually be talking to in a day when you're serving someone or supporting someone. And we look at loneliness and we look at the epidemic that that is, and just remember that people might be experiencing a lot more than they're coming to you with, like I was mentioning before, and being that warm and engaging person, you don't know the impact that that might have, and that you literally could be the only person that someone's engaging with, and it could really make a big difference, not just in that moment, but also in how they feel related to their community, the belongingness, and some of those other elements that are really important as when it comes to identity and self-worth too.
Great. Thank you for adding that in. That I agree 100%. You don't know what someone's going through. You can say you've been there, done that, but if you truly haven't, you really don't know those experiences, and it makes it interesting for sure. Um, so I'm gonna go back to Dr. Carino. Um, how can mental health services for veterans and BIPOC communities experiencing housing insecurity be made more accessible and safer, especially in the context of the COVID-19 pandemic?
Yeah, so this is important question, and I think there's three general interventions that can be highly effective to address homelessness and increase people's access to housing. The first is permanent supportive housing. So housing where there's financial supports and case management supports, extraordinarily effective for individuals with mental health conditions, chronic disabilities, um, and there's good data to show that permanent supportive housing improves significantly healthcare outcomes as well as housing outcomes. So having access to permanent supportive housing is important. You know, at Janie and Medical Care at UCS, we consider um, housing as healthcare, and it's something that one needs to have access to, and it can make a big impact on people's trajectory. I think the second thing is really the access to really warm, accessible care, and this comes down to the relationship. Something that Shannon was referring to in terms of loneliness. Um, that individual connection with an individual at risk of homelessness um, and housing insecurity has a deep impact. And when there can be social support, psychiatric care, primary care, addictions care as part of that connection, it can have a powerful impact. What we saw in COVID-19 has been that the substance use opiate overdose epidemic has increased. The mental health crisis has increased, and having those relationships and clinicians, case management support that's accessible and building on relationships with people at risk of homelessness or experiencing homelessness is so important. Um, one of the things that we've seen in terms of serving veterans is that many veterans will access services through the VA, but we've also worked at times and have psychiatrists in permanent supportive housing sites that are not in which people access psychiatric care that's not part of the VA, and having those options, having people be able to access psychiatric services in ways that they prefer, in ways that are accessible. That's so important. I think the third thing that we tend to think about is that, for people that are in housing and once they get into housing, to provide wraparound support for them that promote their recovery. And in particular, we see things like supported employment. We see things like access to family supports, long-term psychotherapy to be really effective as well. And in terms of the COVID-19 challenges, having access to those supports is even more essential and associated with better outcomes. just like housing is healthcare, supported employment for vulnerable populations also leads to positive healthcare outcomes as well.
So, Dr. Karina, I'm going to come back to you again. I believe you mentioned earlier about person-centered trauma, informed trauma care. So what's the role of trauma-informed care in providing mental health services to vulnerable individuals experiencing housing insecurity? Um, I know when we rolled out our veterans housing program in 2014, um, that was terminology that was completely foreign to us, and still is to a certain degree.
Yeah, it's a really important question, and one of the things that we see, and I think that we're getting to, is that many of the individuals that we're called to serve have experienced individual trauma and also are experiencing structural policies and structures that are traumatizing. And unfortunately, many of the services that people experiencing homelessness are going to encounter um, are need to work hard to provide trauma informed care and support. Um, and trauma informed approaches can take different forms. One approach um, is that the person making the connection, the service provider, is mindful of the traumatic past and experiences that the person may have, um, that they're that it informs their interactions with the individual, that the person really is aware of the most effective ways of interacting with the person given the traumatic nature. I think one of the things that comes up in our psychiatric care, and we work in the streets providing psychiatric services in the community, is that many of the folks that we engage on the streets have a history of um, traumatic events and abuse that they've experienced from individuals that were caregivers and from authorities, and people charged with caring for them. And so what common sort of interaction and approach is to be mindful, is that people are skeptical of us and have that traumatic history. Is okay, now there's someone who's going to offer me housing and support that's in a position of authority, and I have this history of not being cared for and not believed and sometimes abused by somebody in authority. And so by having a mindful approach towards that, um, by considering that person's life experience, um, that we then can engage them more effectively to build the relationship and build that safety and that trust. That's really essential. And the other piece that we see is trauma specific services,
Mm.
which and that's been something that's really important and underutilized. And it really builds off of trauma informed engagement, that once you develop a relationship and connection with someone, to actually address, and oftentimes it involves helping them access housing, um, to finally sit down and address the post traumatic stress disorder, the other sequelae of trauma they may be experiencing through things like talk therapy, medication approaches, um, and other sort of treatment modalities. So I think um, having those approaches is really essential. And once you have the relationship and can build on that, you're much more likely for people to access trauma specific treatments, and people can respond to that care.
Thank you. Dr. DeShantz, I'd like to throw that same question to you, to get your thoughts on that as well about trauma-informed care.
Yeah, absolutely. I think a trauma-informed lens is incredibly important when we think about mental health care access and particularly housing services. Um, I think, like you mentioned, trauma-informed was a term that was new to me until years ago. And I remember when I did learn about it, while I was actually working as an intern in a family shelter. Um, one of the things they really emphasized, which stuck with me, was the necessity of making sure that all of your staff and all of your facility are trauma informed. So not just your clinicians or your front desk person or your case manager, but also the janitor or the person serving food in a cafeteria setting, because those folks are also interacting with people who are likely still being impacted by the traumas they have experienced. And so giving those folks the training to really look at either those behaviors that they may find strange or even a little alarming and look at them through a trauma informed and a compassionate lens. Um, I think when we think about LGBTQ young people, we really need to think about so much of what Dr. Karina was saying about mistrust of authority or having negative experiences with caregivers. That also resonates with a lot of folks in the LGBTQ community. Many LGBTQ young people have experienced abuse or neglect in their homes, sometimes directly caused or like because of them being open about their LGBTQ identity with their families. Some of them have experienced harassment and discrimination in schools. And then all of that leads to them being pushed out of these supportive environments, families, schools, workplaces, and then struggling with housing, and then again, indeed, their mental health. And so thinking about, what are some of we also know that people can experience trauma based on their different identities. So, experiencing an experience of violence or harassment due to your LGBTQ identity, or your racial or ethnic identity, or your religious identity, um, giving folks the space to be able to talk about that openly and talk about how that impacted them, and and then us as practitioners being aware that those types of trauma exist and to be on the lookout for those kinds of trauma and those manifestations of trauma in particular communities, I think is particularly important.
Um, I liked your kind of opening statement there about including all of your staff. I honestly hadn't given that a whole lot of thought until just now. I know, on our habitat side of the equation, I have folks that work hand in glove with um, our future homeowners, applicants, folks applying for homeownership through our program. And then on the servicing side, on the back end, once they're in their house and been in there for a while, um, you know, but even our construction um, site guys that we have as staff and our key volunteers probably should be even included in that as well. So, um, we've discussed a few or the importance of some specific approaches, but what are some long-term strategies for building sustainable and supportive communities for various populations? And I'll just throw that out to whoever wants to respond first. Maybe I don't know. I'll maybe pick on Shannon, I guess, because we haven't heard from her for just a few minutes. So we'll throw that one to you first, Shannon.
Thank you. No, I think it's really being aware of who you're serving, being aware of your community and being aware of the resources that are available locally and then also nationally. One thing that we see in the military is this culture of resilience. And that has pros and cons, right? We hear the military community is resilient, but there can be a toxic element to that, and that's one thing that we're really looking at as an organization is, are you at a point where you've been so focused on getting through things because you have to through things because you are resilient, that you don't take the time to look inward and really kind of recognize areas where you may need additional support and recognize that sure, there might be someone worse off, but you also have to take care of yourself. And so you can take care of your family, take care of the service member, whatever that might look like. And so I think that really giving people the safe space to have those conversations, to be vulnerable and to be authentic in your approach when working with people is core. And when we look at the way that the world is right now, we look at how much exists online, and coming out of the COVID environment, people are really looking for that human connection and that human interaction. And so being there for people and making those intentional connections wherever possible, I think is important. And that requires looking outside of your day to day and really thinking about the person and taking a person centered approach to the work that you do.
Absolutely. Thank you.
Yeah, just to piggyback on that, I do think that having people with lived experience influence and have a voice in building services and in providing services is really essential. And it promotes this sort of healthy communities that can sort of give back, and also ensures that they're person centered, um, if people have voices. So at CUCS, Janie Medical Care, we have a consumer advisory board that's extraordinarily active, that have lived experience of homelessness and mental health conditions. Um, and, we really listen to them in terms of services when we're designing new services or considering going into new programs. Um, we have our consumer advisory board advise us on how what those services should look like. They teach our primary care providers and psychiatrists in grand rounds about how to provide effective care, and how to intervene more effectively with folks. And they're very much a vocal part of what we do, and it's been extraordinarily rewarding to see people that were experiencing crisis, to sort of get to a space where they access housing and give back, and then having that peer-to-peer connection in which they can connect with folks experiencing homelessness in a way that maybe psychiatrists, caseworkers, social services support might not be able to. And once you see that connection and that sort of meaningful connection, that's extraordinarily rewarding to see where somebody's giving back, and really connecting with another individual in a way that we as sort of helping professionals might not be able to. So I think having a really healthy and active consumer board voice, I think that's extraordinarily important, and really anchoring, I think, for an organization, and works to build healthy communities.
I love that. We call our advisory board our secret sauce. And I think that it's really taking the time to listen and have them inform the work that we're doing, but then also leveraging the networks that they bring to make sure that our programs, our resources, the resources that other organizations provide are reaching the families that we're trying to serve, because it's a lot more meaningful when you're hearing from someone who's living, breathing, eating, sleeping the same life that you are versus an organization, or in our case, the Department of Defense or Department of Veterans Affairs. And so we've really seen that be a key element to our success as an organization. The other thing, too, is really being thoughtful about how you're evaluating your programmatic work and not being afraid to optimize and not being afraid to move away from something if it's not working. And so we have a program evaluation team within our organization, and we are very intentional about making sure that we have mechanisms to measure the effectiveness of what we do. And that allows us to make sure that we're not spinning our wheels or wasting resources in an area where we're not getting to the outcomes that we want to. And so sharing the information, making sure that we're leveraging best practices, making sure that we're utilizing data and that peer to peer approach is really important.
Building off of these lovely, awesome comments, when you asked about LGBTQ, or excuse me, when you asked about sustainable communities, I started to think about the barriers that LGBTQ young people might encounter when they're trying to join such a community, right? And one of the things that both housing services and the military have in common is that they tend to be very sex segregated. So they tend to separate men and women, whether that's in dorms or in living facilities or in entire units. Apologies, I'm ignorant about some of the intricacies of the military side of that. That is a huge barrier for transgender and non-binary folks of all ages, right? It is very difficult to access a service if you are concerned that someone is going to force you to use the facility that does not align with your gender. It is very challenging for non-binary folks to fit into that binary system of organization. And so making sure that your community, your services, your organization has gender neutral options for folks to access in addition to sex segregated spaces. Making sure that all of your paperwork is also asking about folks' identities in inclusive ways. Another really big barrier for trans and non-binary folks in particular is sometimes there can be an incongruence between your legal identity. Sometimes your legal name is still your previous name. You may not be using that name anymore. You may not look like a person who has that name anymore, and therefore, when you present your identification or when you go out to fill out a housing application or apply for a mortgage, it can be very scary to sort of out yourself. It can out you suddenly in ways that you don't always have control over, especially with like credit checks or other forms of banking. That in particular is a really tough situation for folks because updating all of those documents is expensive and time consuming and requires a certain amount of legal literacy. And so making sure that your staff again are aware that some folks may need extra help in approaching applications. Um, yeah, and then I think also once you've once you've completed a cultural competency training with your staff and you feel like folks in your organization can handle these issues with competence and compassion, then also advertising that to folks in the community is really important. So whether it's like a rainbow sticker or doing outreach in pride events in your community, letting folks in our community know that you've done the work to be allies with us makes us feel like we can walk in the door much easier.
Yeah. Yeah, I know when we first started talking about working in the veteran space, specifically with formerly homeless veterans, we had an opportunity to involve them in the conversation, which was a really critical part of the buy-in to the program from our side. We rolled this out, and the size of everything from the size of our house that we built to or build to um, including folks who are physically able to come out to our construction sites and work at construction sites and make accommodations for those who aren't physically able to. They would come into either our administrative office and help us do various administrative tasks. We have 2 Habitat restores, and it's a retail environment, and we kind of they became our welcoming face in order to get some of their sweat equity hours to continue on in our program and meet all the requirements of our program. But getting back to the house design, size of the house and what that looked like, it was really interesting in talking with our veteran participants that they didn't want anything large to take care of. They wanted and so we really drilled down working with the case management staff at our local VA medical center about which populations would be best served through this particular program. And we ended up serving individuals and coupled veterans, which has been sort of our forte. Veteran families with children, a single child or multiple children, we encourage to apply through our regular homeownership program. But our Veterans Housing Initiative program serves individuals and coupled veterans. And we didn't really reach out to coupled veterans for a couple of years of being into this, wading into the weeds on this. And it's been a real blessing to be a part of kind of the end piece of that housing continuum. And we're really excited about this pilot program. I really want to thank our panelists for this, an engaging discussion about, various items beyond, our working with veterans. That's sort of kind of what we, specialize in. And we have I have, kind of a connection with Shannon on that level. But with the other 2 panelists, I really appreciate the insight and the advice and your expertise in your areas to share and willingness to share with us. We're getting ready to move to our Q&A, and I encourage our audience to drop your questions in the chat for our panel. But before we do that, what is for our panelists? What is one thing you wish more people knew about your line of work or these particular issues that we've been talking about today? And Dr. DeChamps, since you spoke last, I'll just turn it over to you.
Yeah, I would love to echo something that Shannon talked about earlier. One of the statistics that I frequently end with is we have found through our work that LGBTQ young people who report they have access to at least one adult in their life who affirms their LGBTQ identity report nearly 40% lower odds of a suicide attempt in the past year. And to me, what that statistic really shows is that being an ally matters and that relationships matter, like Shannon was talking about. And so to me, what that demonstrates is those of us who are adults and who are working in youth serving organizations, whether that's schools, faith communities, after school programs, sports. We all have the opportunity to be that adult in a young person's life if we just take the chance to have some of these conversations about folks' identities, about these issues, about the politics going on in the world, but being open to those conversations and open to seeing young people for who they really are is a potentially life-saving action that adults can take to help LGBTQ young people.
Thank you very much. Yes, absolutely. Dr. Carino, you want to take a stab at that one
Yeah.
next?
Yeah, thanks so much. So, I think one of the things that we see are that people with severe mental illness that are hospitalized, for the most part, oftentimes don't follow up in traditional clinics for psychiatric care post hospitalization. And we've been talking a lot about ways that the healthcare system could be more aligned and accessible to people experiencing homelessness. And one of the things that we found to be highly effective is to build out psychiatric services, have social justice minded clinicians embedded in social service program sites in the community. And what we found through that approach by having psychiatric practitioners, mental health workers embedded in all areas of the homeless services and housing system is that people really respond to care. They stay in housing, they improve in terms of their outcomes, and those services are much more accessible. So, as you're sort of building and thinking about services, really important, we've been talking about like sort of building services around people and not sort of building services and then asking people to jump through hoops to access them. Really important to embed, to integrate psychiatric care services and support into the systems that are built and that are working with people experiencing homelessness or at risk of homelessness.
Okay. Shannon?
For me, it's going back to the cultural competency, but also realizing how connected these issues are. If you remove housing, you have this cascading effect of other areas of your life that you're going to likely struggle in as well. And so making sure that you're looking at the whole person and not the issue that they are necessarily bringing to you, and really focusing and being that warm listening ear, and making sure that you're doing what you can to connect people to the other resources that might be available locally, but also knowing, as much as you can about the population that you're serving and some of the challenges that they might be experiencing.
Fantastic. So we're going to transition now. We do have some questions that folks have dropped in the chat box. Um, First one is it's a two-part question. So, what are some red flags or things that folks should be aware of to support friends and families in need? And the second part of that question is, what steps should folks take to support them?
The caregiving and support population is something that is really important within the military community. There's been a lot of focus on that over the course of the last several years in particular. And so I think that it's making sure that you have to take care of yourself so that you can take care of others in your life. There are programs like the Coaching into Care program at the Department of Veterans Affairs that are specifically designed to help loved ones who are trying to get family members or friends into mental health support. And so I think that, again, being there, being a listening ear, making sure that they are not putting themselves so far on the back burner that they then, find themselves in a challenging situation as well. And then being aware of some of the more logistical challenges that people might face and freeing up space for them. So for example, childcare is a huge challenge. So, if you can be aware and help people connect to local childcare, that can give them the space to go to their own doctor's appointment or, go work out and do something for themselves. And I think that the more that we can support in the logistical areas, that frees up the time for people to do the work that they might put, again, on the back burner around themselves.
Dr. Carino or Dr. DeShantz, either of you have thoughts on that question or questions?
I think a couple of thoughts around sort of red flags and maybe mental health indicators that are important to consider is if individuals are expressing mental health distress and crisis to do what we can to connect them to care and support. In particular, if people with a history of mental health challenges are disengaging, at risk of homelessness, experiencing homelessness, have a relapse, to really sort of listen to that and do the best that we can to help folks access services and support. Um, Oftentimes, they there are community members that are connected to people, that can be really substantive in terms of people accessing care. In terms of what steps that may be made, I think a general approach at times of just listening to the person, right? So if the person's in distress and they're saying, my problem is housing, I don't have housing, and they repetitively, are going to the emergency room, or going to or at risk of incarceration, to really meet them where they're at, and do your best to build services where you're supporting them around those goals to get housing, um, to listen to that distress, to hear it, and to do the best we can to connect them to the services that folks are experiencing and requesting.
Thank you. So we've got about 5 minutes left, and I have another question from the Q&A chat, and this one sort of rings near and dear to my heart after having experienced two major floods in the community I grew up in, and most recently flooding in our adjacent state in eastern Kentucky. So can one or two or three of you, whichever, address disaster-related trauma care or case management and the intersection of housing? And whoever wants to go, be my guest.
I can speak from a very high level. We've seen this in some military areas when there have been storms come through, and the impact that that has on the housing situation from a temporary as well as long term perspective. Families spending a lot of time, a lot longer than they expect in hotels. Everything from doing laundry to being able to cook a meal for your family. These are things that give people that self efficacy that's really important to an individual and to a family. We've also seen some of the second order effects of storms related to the condition of military housing. And when you have the high humidity, when you have these storms, we've seen a lot of challenges around mold after that. I'm not sure if that's specifically answering the question, but I think that when there is a disaster, making sure that you're not just, again, treating the issue, but you're aware of some of the other challenges that might be happening, and bringing in counseling, bringing in mental health support, bringing in things like the Tide trucks that people can, do a load of laundry, are things that really make a big difference in people's lives.
Absolutely. Gentlemen, either of you
And
we've got 2 minutes left. If one of you all want to talk about
Disaster relief is a little bit outside of my area of expertise, but I will share a little bit of what we learned from the COVID-19 pandemic, which I think is applicable in other local disaster situations. What we saw was that when COVID-19 disrupted all of our lives, that LGBT young people got disconnected from many of the supportive environments in their life, right? So if you're an LGBTQ young person and your primary networks of support are maybe a supportive teacher at your school and then your friends at school, and then the pandemic or another disaster comes along and suddenly you aren't able to go to school and you are at home where maybe you are not able to be out, or maybe your family is not open or even openly antagonistic to talking about your identity, you are now sort of trapped, and your world has become much smaller and your world has become much less affirming. And so when I try to think about how we might apply that to other situations, I think, this disruption of those human relationships, the disruption of being able to go to your drop-in center, if that's where you're getting support, or your school, your faith community, that can all really be impacted by these kinds of disasters. So making sure that when we are that in addition to all of the like really really important material goods that we try to provide folks, like Shannon mentioned, around laundry and housing, that we're also providing some soft social supports around making sure folks can stay connected, or build new connections.
Fantastic. Thank you all so much. for your time today, for sharing your expertise with the audience. I would like to thank our audience participants. Um, as we look to serve our communities in bigger and better ways, I know that the topics that we've talked about today will become even more important as we move forward to serve our communities in bigger and better ways. Again, I would like to thank our panelists, Drs. DeChance and Dr. Crino. And Shannon, thank you again so much for your work with the Military Family Advisory Network. I'm encouraged to have been part of the conversation and hope that our audience has learned as much as I have today from you all. And look forward to working with you all or reconnecting somewhere down the road. Again, thank you so much. We appreciate it.
Thank you.
Thanks so much. Bye-bye.